Hi, I'm Dr. Christina Hahn, dermatologist and medical director here at Zion Health. The topic of today's video will be on minoxidil and specifically the side effects of minoxidil. The risks of minoxidil will really depend on whether you're taking this medication orally or topically. Let's refresh ourselves on what minoxidil is. Originally, it was discovered actually as a medication to lower high blood pressure, and doctors noticed that patients that were being treated for their high blood pressure had increased hair growth. It's now available in 2% and 5% topical formulations and is FDA approved. The oral pill, however, is not yet FDA approved, but doctors often use it off-label for the treatment of hair loss. Minoxidil likely works by relaxing blood vessels as well as promoting the formation of new blood vessels. As a result, increased nutrients and oxygen gets delivered to the hair follicles. It's also thought that minoxidil promotes the active or growing phase of the hair cycle. Does minoxidil have side effects? Like any medication, minoxidil can have potential side effects. The risks will depend on whether you're taking this orally or topically, as well as the dose and concentration being used. Oral minoxidil side effects include low blood pressure, dizziness, rapid heartbeat, headache, hypertrichosis or excess hair growth elsewhere on the body, and pedal edema, which is swelling of the hands and feet. In general, the higher the dose of medication, the more likely of potential side effects. Meanwhile, topical minoxidil side effects can also include skin-related irritation, dryness, and flaking, as well as hypertrichosis or unwanted hair growth, particularly to the facial area. Because this is being applied topically to the skin, there is much less chances of absorption and therefore systemic side effects. It's important to remember too that the 2% minoxidil lotion formulation can contain alcohol, including an ingredient called propylene glycol. This can rarely cause an allergic type of reaction on the skin, so it's important to inform your doctor of any potential sensitivities or allergies you may have. Also, just like finasteride, minoxidil can cause temporary shedding early on treatment. This often is temporary and is not a cause for concern. However, if the shedding persists for more than 3 months, it's important to talk to your doctor about this. Are there any additional safety precautions about minoxidil? Well, the good news is that most patients can safely take minoxidil without experiencing any side effects. However, there are a group of patients that should be a bit cautious and should speak to your doctor. These include patients that are pregnant, breastfeeding, have a history of excessively high or low blood pressure, or a history of heart disease. If you have any of these conditions, then it's important to talk to your doctor first before proceeding with oral or topical minoxidil. In summary, minoxidil remains an important treatment option for the treatment of hair loss in both men and women. It's available topically and orally, and the topical side effects will largely be mostly skin-related, whereas oral minoxidil can have broader systemic side effects. Generally, the risks of side effects are low, and the benefits often outweigh the risks in the majority of patients. At Zion, we strive to offer patients the best performance hair loss treatments out there. Ultimately, safety is the most important and our priority. For example, our topical finasteride and minoxidil combination treatment in siloxysystem gel allows for sustained delivery that's targeted to the hair follicles over time. This allows for less medication to ultimately end up in the bloodstream and hopefully less side effects. If you're concerned about the side effects of minoxidil or aren't sure if it's the right hair loss treatment for you, we highly recommend speaking with your doctor. With so many options for hair loss out there, there's something for everyone. If you like this episode, don't forget to hit subscribe or like. Thanks so much for joining, and we'll see you at the next one.